Angela Brown, MN 669, Unit 1 Journal. My clinical experience in mental health throughout the psychiatric mental health nurse practitioner program. My clinical experience has been very eye-opening. It has been very interesting. I've learned a lot. I've seen a lot so far. And it further lets me know, reminds me of why I decided to continue my educational journey to include psychiatry, psychiatric mental health. The reason I've chose to work in this field is I always wanted to work in this field, but I did not want to be the therapist. I wanted to, just care for the patients. And I thought that being a psychiatric nurse practitioner entails sitting across from the patient and listening to their trauma history. I have learned to some extent you do listen to their trauma history on initial intake, psychiatric evaluation, but you're not the therapist. You're not the psychotherapist. So I would not have to sit there and cry with the patient, or the patient probably would even cry, but I would cry listening to, the sad stories. Like I don't need to hear that you have PTSD because you watched your dad chop your mom's head off at 7 years old. Like stuff, I just can't. Let's see. So I started off as a family nurse practitioner. I started here at Purdue. I completed the family nurse practitioner program, and I had a pleasure of precepting with a doctor who's seen primary health and also mental health. I seen what he did, and that's what I made the change. I said, yeah, this is what I want to do. I want to manage their medication to help them be able to live their life as normal as possible in society. I don't have any concerns, even with even being that this rotation in this class has a focus on children and pediatric and adolescents. I have some experience dealing with this population, seeing this population in the family nurse program, family nurse practitioner program. So I'm comfortable with it. Yeah, I'm a bit comfortable with it. So as far as personal and academic or professional goals for the clinical course as you wrap up, my goal is to, first of all, I would like to do telehealth and see psychiatric patients, mental health patients. And in the future, I do want to open my own practice and see both populations, the primary care health and also the mental health. I do want to go back and get my DNP. At first I was unsure about it, but I've always done my programs accelerated, And I think I will go back for my DNP, and I would do the traditional route versus accelerated. I'm pretty tired. um, let's see. My goals for this course is to learn as much as I can to be able to basically diagnose patients. I want to be confident and comfortable with diagnosing patients. I'm okay with it, but I mean, I know I won't become a pro or anything. It takes years for that. But I want to be comfortable when I go out into the field with treating my patients. So that's my goal, is to really learn how. I'm pretty good with documenting, and I just want to be good at diagnosing. Strengths or weakness that I've identified throughout the program, basically what I just said. Like, I diagnose, but you know, we really don't get the feedback so us know if our diagnosis are the correct diagnosis or not. That's what I getting a phone call. I keep pushing the voicemail. But that sums up my journal. Thank you.